So, do you need to talk to someone? Okay. Mental health care. Let's talk about physical health care. Do you go to your primary care doctor every year for your annual visit? If you're a woman, do you get your well woman visit? Or if you're a man, do you get your prostate exam? Do you take your kids in and follow, the guidelines for the different types of health related care that we need? And we never really think about what kind of mental health care do we need. Well, let's go over what's available to you. I'm Kathy Shorman. I am a licensed clinical professional counselor and a trauma expert and the owner of Monarch Therapies. And we'd love it if you'd visit our website, drop us a line, and we can discuss what kind of mental health care maybe you are looking for. So let's get into it. You know, I am a counselor, and a lot of times people are seeking counsel. You could seek counsel from a lot of different people. You could seek counsel from your religious leader, from your financial advisor. You could seek counsel from a mentor in your profession. Counsel is more of, I'm needing direction on this specific subject. Counseling is more, there are certain subjects or things in my life, patterns that might be interfering with my ability to feel healthy as I live my life. And so in counseling, we will examine those patterns, those relationships, and kind of get to the root cause and then help you develop skills in order to navigate through those challenges in your life or build healthier relationships or whatever your goals are. Then in the middle of that, there's coaching. And coaching, I know a lot of really great coaches out there. And the difference I find between coaching and coaching is more about, I have a specific goal. I want to grow my business. I want to lose weight. I want to fill in the blank. And a good coach can sit down with you, listen to what your goals are, help you elicit what are your top goals, develop a plan with you, and then hold you accountable to that plan. Great coaching is so important when you have those specific goals in mind. Counseling is more like, gosh, I'm noticing these things. Something's not feeling right. I'm not feeling healthy. Let's dig into it. Now, in counseling, there's individual counseling, there's family counseling, there's marriage counseling, there's group counseling. And in a later video, I'm going to talk about some of those. And that, what I'm going to say here is don't be afraid to explore the different types. Once you're in, a lot of people will seek out individual counseling at first, and there are a lot of benefits to group counseling. There are a lot of benefits to family counseling. And when you find someone you trust, talk to them about what's going on and maybe try some of those other types of counseling to see if they help you. We've also got higher levels of care in mental health care. And these are usually needed when there's safety factors. Okay. So there's things like intensive outpatient, partial hospitalization. I like to explain it like school. And intensive outpatient is like half-day classes. You go 3 to 5 days a week for 2 to 4 hours a day. There's a group setting, there's individual. You're going to maybe meet with a doctor at some point during your time there, and you're going to get a lot of insight into coping mechanisms around specific subjects. Partial hospitalization, I want you to think of that as like full day school. You're going to go 5 days a week. You're going to go 4 to 6 hours a day. The difference between the two, honestly, is around severity and safety. When someone is presenting like with depression or substance use or an eating disorder, and the level of severity, how it's affecting their life is so severe that maybe they need that multiple times a week, multiple hours a day, safety space in order to focus on their goals. That's when you need to explore those levels of care. Then there's also higher levels of care, residential and inpatient. Again, safety factors. Residential is more longer um, term. Inpatient is really when someone can't be trusted to keep themselves safe or people around them safe. Those need to be determined in a facility. You can always call 988 if you're unaware of what you or your loved one might need. So that's a brief overview of all the different types of mental health care. Again, you can contact us at Monarch Therapies. We'd love to see you on our website. We would love to talk to you about what you or your loved one might be needing. And I hope that what you took away from this is mental health care is healthcare. And I see you and I love it. I'll talk to you later.